Hello, my name is Elizabeth Saywick, and I'm the director of the Stigma and Resilience Among Vulnerable Youth Center at UBC School of Nursing. And today, with my colleagues Ashley Taylor and Ace Chan, I'm going to be presenting our research on linking provincial health policies, identification documents, and gender-affirming healthcare to the Canadian trans and/or non-binary youth health. Canada is one of the countries that's considered quite progressive when it comes to supporting trans and non-binary people. In fact, in 2017, in June, our Canadian Human Rights Act included new terms prohibiting discrimination on the basis of gender identity and expression. In addition to the national Canadian Human Rights Act, many of the other provinces added gender identity and expression as prohibited discrimination in their provincial human rights acts as well. Given that there is this supportive legal framework for trans and non-binary young people, you would consider that chances are we've got really good access to gender-affirming healthcare and good legal supports for young people supporting their gender. However, because it's only been 2.5 years since these legal changes took place, there's still a work in progress. And part of our research is actually to understand how well things are coming. So for our presentation today, we had 3 major questions we asked. The first is, how is access to gender-congruent ID related to health outcomes, including mental health outcomes? The second is, does having a primary care provider increase your access to gender-affirming care? And is youth comfort with their primary care provider related to accessing gender-affirming healthcare? And then finally, what is the link between Canadian provincial health services policies and access to gender-affirming care? To answer these questions, we'll first talk about the source of our data, a little bit about the participants in that data source, and then I'll hand it on to Ashley to talk about identification documents and health. After which Ace will talk about primary healthcare providers and access to care. And then I'll come back in and talk about the influence of provincial policies and health. We'll also finish up with an opportunity for a live question and answer period. And so please be thinking about the questions that occur to you as we're giving this presentation. So first, let me talk about our data source, the Canadian Trans and Non-Binary Youth Health Survey. This was an online survey of youth health for young people ages 14 to 25 years. Now, this was actually a repeat. We did the first national trans and non-binary youth health survey in 2014. We repeated it 5 years later, between November 2018 and May 2019, in both English and in French, with a variety of questions about young people's health, experiences of healthcare, family, school, lots of different options. Within the survey, we asked a number of different gender identity questions, and each one of them was followed by 3 follow-up questions. One, about how much you liked or hated that question. Second, about how well the response options fit you. And then an open text box that allowed people to put in whatever comments they wanted to make. The quotes that are provided in our presentation today are drawn from those text boxes and that open-ended comments throughout the survey. Now, our Canadian Trans Youth Health Survey team includes researchers from 8 different Canadian universities across Canada, as well as Dr. Jamie Veal, who is at the University of Waikato. Our researchers are both Francophone and Anglophone, trans and cisgender, and they include postdoctoral fellows, graduate students, and undergraduate RAs in addition to senior investigators. We also had co-researchers from several different community organizations across Canada. And because this was research about young people, and Saravik is committed to Nothing About Us Without Us, we also convened youth advisory councils of trans and non-binary young people in several different provinces, as well as an online Facebook Rural Youth Advisory Council. Now, these youth advisory councils both helped us identify what were questions that should be added to the new survey, as well as how to best recruit participants from across Canada. They helped us do that recruiting. And when data were collected, we brought the data back to them for them to identify things that we should actually analyze, questions that they had about the data, the interpretation and explanations that they thought some of the information provided, as well as what they would recommend as the priority areas to focus on in addressing trans and non-binary youth health. So let me tell you a bit about the participants of the survey. We had more than 1,500 young people across Canada in every territory and province, although the largest numbers of young people actually mimicked the larger population sources. So for example, the largest numbers were in Ontario and Quebec and BC, whereas much smaller numbers of participants came from the territories. This, of course, is also in part because the territories are less likely to have access to online services, and that digital divide does create some challenges for being able to tap young people in the far north. When it comes to the survey, the majority of young people took the survey in English, 10% participated in French, the majority of them from Quebec. About 12% of our participants identified as Indigenous, whether Aboriginal generally or First Nations, Inuit, or Métis. And while we did have young people who participated from age 14 to 25, they tended to be on the older side of the equation, and the average age was close to age 20. And the majority of young people in our survey were born in Canada. And when it comes to the gender identity questions, this was probably one of the simplest ones, and basically asked about gender identity in 4 different ways, with I'm transgender and I identify as boy or man, I'm transgender and identify as girl or woman, I'm transgender and identify in some other way, and a small percentage who said I'm not transgender. Now, when we looked at the other gender identity questions that small group also answered, we realized that all of them identified as some form of gender non-binary or gender queer or gender fluid, and that they didn't identify as trans. Another gender identity question that was part of the survey was one that allowed people to mark any of a number of different options. So these were different questions, different wording that had come from other surveys and other ways that young people describe themselves, and participants could mark all that apply. And in fact, among our participants, many of them identified multiple different checking those boxes. Now, this can be a type of question that in fact many of them identified as liking the best because it gave them lots of different options of words. But as you might consider, it can be a little more complicated to have this many different categories as we're talking about the experiences of different gender identity. But as we knew from the survey, gender is complicated. So for example, someone from New Brunswick talked about, even though I still strongly identify as a trans man, there's a piece of me that sometimes leans a little less man, and it's complicated. Or a non-binary young person from British Columbia talking about their gender identity. When talking to cis people, I describe my gender as not a man, not a woman, but a third option without limits. And now I'll hand it over to Ashley to talk about identification documents and health. Take it away.
Thank you, Elizabeth. Hi, everyone. My name is Ashley, and I'm going to talk you all through the identification documents portion of our presentation today. Before discussing IDs, I'd like to give you all a little bit of context about the youth in our survey. We asked youth if they are currently living in their felt gender, and 50% of the youth reported that yes, they are living in their felt gender full-time. 36% of youth are living in their felt gender part-time, and 14% are not living in their felt gender. We also asked youth, do you want to change your name? And 78% of youth said yes, they would like to change their name. However, When we asked, have you changed your name to reflect your current gender identity, only 30% of youth reported that they had done so. Moving on to identification documents. We asked youth if they had the correct gender listed on 8 different identification documents. We asked about youth's birth certificate, healthcare card, driver's license, foreign passport, school records, student ID, medical records, and Canadian passport. Youth were most likely to have the correct gender listed on their birth certificate and their healthcare card, and youth were least likely to have their correct gender listed on their foreign passport and Canadian passport. It is important to note here that most youth said that the wrong gender is listed for all 8 identification documents. We also asked youth about the reasons why the gender on their ID is incorrect, and 58% of youth plan to but have not tried to change their gender details yet. 39% are worried that changing their gender might put them at risk of harm or discrimination. 38% cannot afford to do so. 37% reported the gender options that are available do not fit their gender. 33% do not know how to do this, and 16% are not allowed to change their gender on some documents because they have not taken medical transition steps. We gave youth the opportunity to write in additional responses detailing reasons why the gender on their IDs is incorrect. We received several hundred write-ins, and we have shared 3 of them with you all today. I do think it's important to note that the majority of the write-ins were youth detailing their parents and or guardians being unsupportive of them in this process, and in fact being transphobic in some situations. We also asked youth if they have ever experienced some of the consequences listed when they have shown an ID with a name or a gender that doesn't match their appearance. And 16% of youth reported that they have been verbally harassed. 13% of youth have been denied services or benefits. 6% of youth have been asked to leave, and 2% of youth reported having been assaulted or attacked when showing an ID with a name or a gender that does not match their appearance. 48% of youth have never had any of these problems when showing an ID with a name or gender that does not match their appearance, and 35% of youth have only shown IDs that match. So why talk about identification documents? Why is having congruent gender IDs important for youth? Well, for all 8 identification documents, having the correct gender listed significantly increased the odds of excellent and very good mental health for all 8 identification documents. We also looked at the influence of identification documents and general health. We found that youth with the correct gender listed on their healthcare card and medical records were more likely to report good general health. And on one of the previous slides, we were looking at the 8 IDs separately. But when we look at them together, we find that the more IDs youth have with the correct gender listed, the more likely they are to report good mental health and general health. In summary, few youth have gender-congruent IDs. Having even one gender-congruent ID is associated with higher mental and general health. The more gender-congruent IDs youth have, the higher their mental, or the better their mental and general health. Significant barriers such as cost, confusing process, and fear of discrimination keep youth from accessing gender-congruent IDs. And those barriers will be further discussed in the policy section by Elizabeth. But for now, I hand it over to my colleague, Ace.
Hi, everybody. This is Ace, and I'll be speaking about primary healthcare providers and access to healthcare for youth. So let's start off with a bit of background for this section. In 2017, approximately 4.7 million people in Canada do not have access to a primary care provider. This is concerning given that primary care providers are the first point of contact with the healthcare system for people who want access to gender-affirming care. The last point is that it's important that people are comfortable with their primary care provider. Based on the context from the prior slide, we were interested in exploring two questions related to primary care providers with our data. The first is, does access to a primary care provider increase access to gender-affirming healthcare? The second is youth comfort with their primary care provider related to access to gender-affirming healthcare? From descriptive analyses, we found that 77% of youth in our study had a primary care provider, and 54% of these youth felt uncomfortable with their primary care provider. Our survey also allowed youth to share some of their healthcare experiences, and one youth wrote, "Waiting to see a doctor because I'm too scared to go ask a random practitioner if they'll start the process. So I've sought out a doctor who has a good history with trans people, and they unfortunately have a long wait time." This is a 22-year-old from Alberta. When it came to puberty blockers, we found that 85% of youth who had a primary care provider reported being prescribed puberty blockers. And the youth who had a primary care provider were 2 times more likely to have been prescribed puberty blockers compared to youth who didn't have a primary care provider. This is statistically significant. We found that 62% of youth who were comfortable with their primary care provider reported being prescribed puberty blockers. And these youth who were comfortable with their primary care provider were 2 times more likely to be prescribed puberty blockers when compared to youth who were uncomfortable with their primary care provider. These results are also statistically significant. For youth who had a primary care provider, 84% said that they had gender-affirming hormones prescribed, and these youth who had a primary care provider were 2 times more likely to have been prescribed gender-affirming hormones. Youth who reported that they were comfortable with their primary care provider, 63% had been prescribed gender-affirming hormones, and the youth who were comfortable with their primary care provider were 4 times more likely to have been prescribed gender-affirming hormones compared to youth who were uncomfortable with their primary care provider. These results are statistically significant. For youth who reported having a primary care provider, 86% completed their readiness assessment for surgery, and 85% said that obtaining this referral was easy. Youth who had a primary care provider were 2 times more likely to have completed the readiness assessment when compared to youth who didn't have a primary care provider. 63% of youth who were comfortable with their primary care provider completed the readiness assessment, and 65% said it was easy to get this referral. Youth who were comfortable with their primary care provider were 3 times more likely to have completed the readiness assessment compared to youth who were not comfortable with their primary care provider. These results are statistically significant. Our survey also collected information on 16 gender-affirming healthcare procedures. I won't go through every procedure, but the next 2 slides explore how access to these surgeries differ whether youth had a primary care provider or not, and whether youth were comfortable with their primary care provider. For vaginoplasty, we found that 82% of youth who accessed the procedure had a primary care provider, and only 18% of youth who did not have a primary care provider had vaginoplasty. For chest surgery, we found that 90% of youth who had a primary care provider accessed chest surgery, and only 10% of youth who did not have a primary care provider had the surgery. We can see that having a primary care provider plays a large role in accessing gender-affirming healthcare procedures. For orchiectomy, 80% of youth who were comfortable with their primary care provider accessed the procedure, whereas only 20% of youth who were uncomfortable with their primary care provider had an orchiectomy. For hysterectomy or oophorectomy, 67% of youth who were comfortable with their primary care provider accessed the procedure, whereas only 33% of youth who were uncomfortable with their primary care provider had the surgery. We can see that being comfortable with your primary care provider also plays a large role in accessing gender-affirming healthcare procedures. So in the previous slides, we talked a lot about gender-affirming healthcare. However, trans and non-binary youth do not just need gender-affirming healthcare, they also, just like anybody else, they also need general healthcare as well. So when looking at general health, we found that 80% of youth who had a primary healthcare provider reported good health. And these youth were 1.4 times more likely to report good health than youth who did not have a primary care provider. 58% of youth who were uncomfortable with their primary care provider report poor general health. Youth who are comfortable with their primary care provider, however, are 1.3 times more likely to report good health when compared to youth who are uncomfortable with their primary care provider. These results are statistically significant. When we looked at foregone physical health care, 82% of youth who had a primary care provider did not delay access to physical health care. And these youth were also 2 times less likely to delay access to physical health care when compared to youth who did not have a primary care provider. These results are statistically significant. We also found that 58% of youth who were uncomfortable with their primary care provider did not get physical health care when they needed it. And lastly, we looked at foregone mental health care. We found that 81% of youth who had a primary care provider did not delay access to mental health services. However, we also found that 59% of youth who were uncomfortable with their primary care provider delayed access to mental health services, and these youth were 2 times more likely to delay access to mental health services when compared to youth who were comfortable with their primary care provider. These results are also statistically significant. So in summary, youth who had a primary care provider and were comfortable with them had more access to gender-affirming care, had better general health, and were more likely to get needed care. We have 2 action items to wrap up this section, and the first is that trans and non-binary people should be prioritized on primary care waiting lists. And the second item is a call to improve trans and non-binary competency in primary care provider practice.
Thanks, Ace. And now I'll talk about the influence of provincial policies on trans and non-binary youth health. Access to gender congruent identification and to gender affirming healthcare services are actually provided at the provincial level, so within each province or territory. As a result, policies, procedures, and the barriers to getting the kind of care you need do vary across the country from province to province and territory to territory. Some of the barriers to getting gender congruent IDs, for example, include that name changes can be published in the Provincial Royal Gazette in some provinces, for example, in Prince Edward Island. This can unintentionally out youth who are changing their name to make it more gender congruent. Now, some provinces actually include an easy opt-out option within their name change application. So for example, New Brunswick has a very easy option within their process, but others don't actually provide really good information about how you can opt out of getting your name published in the Provincial Royal Gazette. Saskatchewan is an example of a province that doesn't provide easy information. In addition, when it comes to barriers, in order to legally change your name or your gender marker on many documents, provinces could require a variety of documentation, things like fingerprinting and criminal background checks, as well as documents from psychiatrists in order to make that name change. British Columbia is an example that requires all of those. Now, these kinds of extra steps to legally change your name or your gender marker risk further pathologizing trans and non-binary youth who are trying to get gender congruent IDs. In fact, among the young people who participated in our survey, there were actually a lot of different comments related to barriers in getting IDs. One Alberta youth really was unhappy about it because they felt getting fingerprinted was like a criminal. Another Alberta youth said you need an official letter from a gender psychiatrist and the waiting list is 2 years long. And a youth from Ontario talked about all the different steps to change being very costly and time consuming with lots of different trips and letters from various authorities, and that's overwhelming. Of course, the legal age to access name change and gender marker changes without parental permission also varies across provinces and can range anywhere from age 16 to 19. And youth under that legal age must have parental consent. Now, some provinces offer a process that actually can help you get a waiver of that parental consent. So British Columbia, for example, has a process to request a waiver of parental consent to change your name. But most provinces don't have that process, and you must have parental consent if you're under the legal age of majority. Now, of course, this becomes a problem when youth have unsupportive parents, or in fact, even hostile parents who refuse to consent to name changes or gender marker changes. When it comes to accessing healthcare, access to surgery is another area that there's definite disparities across the provinces. Some provinces actually require out-of-province surgery assessments at the Centre for Addictions and Mental Health in Ontario, and they offer very limited or, in fact, no gender-affirming surgeries in the province. PEI is an example. Because they're such a small province, they don't have gender-affirming surgeries available in the province, but several other provinces also require surgical assessments to happen out of province. And there are a few places only in the country, depending on the kind of surgery you have, that may actually offer that. And until very recently, in fact, lower surgeries were provided only in the province of Quebec. And so no matter where else you were in the country, you either had to travel to Quebec or you might have to travel out of country to access those services. Now, some provinces will actually cover the cost of those travel expenses to both get your surgical assessment as well as to travel to get the surgery. Manitoba is an example of one that will cover those costs. But other provinces don't provide funding for doing that travel, even though they require the assessment to take place in a different province, or the surgery is only available in another province. So that means that access to surgery is limited by your ability to afford it. In British Columbia, until relatively recently, the travel itself wasn't covered. And in fact, there was a nonprofit organization that would provide that travel support. So again, if you have to travel all the way across the country in order to get access to care, only those people who can afford it are able to do so. So as part of this study, we looked at where youth who responded to the different survey questions related to surgery and mental health and others actually lived, and then identified whether they were in a province that had higher barriers or lower barriers to gender affirming assessments, as well as gender affirming surgery, as a proxy for how relatively easy it is to access the kinds of services that they need. And what we found was that youth in higher barrier provinces were less likely to have completed a readiness assessment for gender affirming surgery, and they were far less likely to report that it was easy for them to get a referral for that assessment. Likewise, youth who were in higher barrier provinces were less likely to rate their mental health or their physical health as good or excellent. And they were also less likely to have a regular family nurse practitioner or doctor. This may be in part because in higher barrier provinces, there may be fewer practitioners who actually are competent in providing care or just are willing to provide care for trans and non-binary people. And so trans and non-binary youth may be less likely to have a family nurse practitioner or doctor providing that primary care. We also found that youth who came from provinces that had higher barriers in their policies to accessing gender affirming care were more likely to report missing out on both needed mental health care and needed physical health care in the past year. These numbers were not hugely different. Clearly, young people in every province experienced significant foregone mental health care, and quite a number of them experienced missing out on physical health care that they needed as well. But in provinces that had higher barriers to gender affirming care, a greater proportion of young people experienced that foregone health care. Therefore, young people that we spoke to about this, as well as we, feel that it's really critical for the well-being of trans and non-binary youth that we actually work to reduce provincial disparities, especially since there are quite a bit of difference from province to province. Given that Canada's discrimination law and human rights code prohibits discrimination on the basis of gender identity and expression, there should be equal access to healthcare and equal access to gender affirming care across the entire country. But we still see variations province to province. It does raise some interesting questions for us in terms of thinking about whether or not in the future, young people will actually identify that disparity between provinces as a form of discrimination and work to get that changed. Thank you. Now we'd like to take the opportunity to take questions from everyone. And while we're having that question and answer period, so think about the questions that you want to ask, I'd just like to take an opportunity to acknowledge our research team and the different people who have been part of the team, including the organizations that helped us with the youth advisories. And of course, I do need to mention that we've been funded by the Canadian Institutes of Health Research. So, questions?
For those of you who have attended, feel free to put your questions in the chat, or if you'd like, you can raise your hand and we can give you the opportunity to unmute and speak your question. No questions at all? We're happy to answer any questions. Oh, you're very welcome, Heather. We're happy to answer any questions about the research itself, about the data source that we have. I should let everyone know while we're waiting for questions that this is a very, very rich data set, and we're continuing to do analyses for a variety of different research questions. And we will be publishing reports and infographics and continuing to publish peer-reviewed papers as well. So if you've got an interesting research question that you think nobody's answering, you can also send us an email and we'll be happy to see if it's something that we can actually undertake with the research we have. Someone's asked the question, is it a problem if IDs do not match? I'd like to get my driver's license and health services card changed to reflect my gender identity to start with. You know, it's an interesting question, and I don't know that our research specifically can answer it, but I have heard from others who share their conversation, you know, their experiences, that it can be a challenge if, for example, you have one document when you're traveling and another document doesn't match that. That can create hiccups during the process of going through customs or the border. But that's also the case when you have the important challenges of having gender markers on your IDs that don't match your gender expression. And so that can also create challenges for people. In fact, there are young people who've talked about if they're going to be traveling and their passport or their ID does not actually match their gender identity, they will go stealth to be able to get across the border. And that's always a challenge for people because of the risks that ends up doing. I do think that in the general day-to-day, you're usually only using one form of ID at any one time. And so having the ones that you use the most often able to match your gender identity and expression is probably okay. But it is one of those things that becomes a consideration that many people have. There's a movement out there, and I know that some of our legal colleagues have discussed the potential of why do we even need gender markers on some of our IDs. But at the moment, there are no movements afoot, as far as I know, in government to actually remove gender markers from key identification. Next question we have is from Richard. If you control for population size, are you able to see differences across the provinces that may be associated with community characteristics? That is a very good question. We have not yet got to the sort of deeper dive into our research to actually look at that potential around controlling for population size, controlling for voting patterns. We've done that with some of the other research we've done in our Project Respect for LGB youth, generally speaking. So it's certainly something that we could look at, figuring out mapping sort of the patterns of recent election voting data, for example, onto our existing data and see if we can identify any sort of relationships in that. So we'll make a note of that and get back to you. Lorraine had the question. We will actually, this is being recorded. It will go up on our YouTube channel. Stephanie, can you speak to when and how we can people can access the information?
Yeah, for sure. So we'll upload it to our YouTube channel. We'll be sending out an email out to all participants, and then we'll also share it on our social media channels. So look out for an email because you're a participant.
Great, thanks, Stephanie. Next question about whether or how the association between having gender congruent IDs and mental health was affected by SES or other covariates. Ashley, you want to take that question?
Yeah, sure. We did look at the association between having gender congruent IDs and impact on mental health. And what we found is that the more IDs that a youth had, the more, the better their mental health outcomes were. So even just having one congruent ID was impactful in a positive way for mental health. We have not looked into socioeconomic status though, or I don't think we've looked at other covariates. I think we've looked a little bit at age, but we weren't really finding anything.
We did look by province, and
yeah, true, we did.
Didn't see huge.
There were not many differences.
I will say that it's kind of tough to ask SES questions of adolescents and even young adults, because oftentimes they wouldn't necessarily know their family income, or even, I mean, I've had surveys where we ask young people about their parents' education and they really don't know, or even, they know that their parent works at RBC, but they couldn't tell us whether they're the vice president of the bank or, the front teller or in the janitorial service. So that doesn't always work very well in terms of figuring out ways to ask young people about socioeconomic status generally. We have asked some questions related to tapping poverty, which can help, but it doesn't give you that sort of full range of understanding SES. Great questions. Next one, did you consider the implications of race and policing in the data collection? We do ask about ethnicity and racialized identities. And as generally speaking, we had the majority of participants did identify as European heritage white. But in terms of policing, I'm trying to remember, there are so many questions we asked. And of course, there were so many questions we wanted to ask, but ultimately, you've got to create a survey that doesn't take 6 hours for young people to fill out online, because they're just going to walk away and not do it. So we had to be really focused in terms of cutting it down when it became really clear that it was going to take way too long to actually do. So I don't recall if we asked specific questions about engagement with the police. Ashley, Ace, any memories of those questions on our survey?
Yeah, I don't think that we have an engagement with the police question on the survey.
Okay, yeah. A great one to keep in mind for next time around when we redo the survey let's see, it would be 2024. Lorraine asked if we addressed levels of family support, ambivalence, or rejection. We actually did ask a lot of questions about family support and family relationships, and we are going to be looking at that. That is another sort of set of analyses that we will be, actually a lot of different analyses that we'll be working on, looking at how family support plays out in a lot of different ways. It was, for this set of analyses, it was really important to recognize that family support did play a role, or family hostility played a role in access to gender congruent IDs. But we will definitely be doing a lot of work looking at family relationships and family support and how that plays out in trans and non-binary young people's lives, because we all know families are important. Question from Michael, given what's happened in terms of trans inclusive policy change around IDs and access to affirming healthcare in recent years, any of the smaller provinces you see as leaders in trans inclusive policy? Because they asked about mentioning some barriers. Good question. Ace, Ashley, anything stand out for you? I'll let you answer first, and then I'll chip in my perspective.
Yeah, something that stands out to me is that New Brunswick actually has a section within their name change document where you can ask for an exemption. So ask that it not be published in the Royal Gazette. And most of the other provinces make it really difficult for you to figure out how to ask for an exemption or not have your name change published. And so I think that that is something that would be great for all provinces and territories to adopt.
Right. Ace, any perspectives?
Yeah, I think in regards to gender affirming healthcare, I think provinces are really pushing to have their own, clinics for either top surgery or bottom surgery. For instance, in Vancouver, we just opened a bottom surgery clinic so that folks didn't have to travel out of province or to the States for their surgeries. So I know that there's going to be push for that. However, when that's going to happen, I'm not certain.
Yeah, I would say my experience over the past decade or so has been that it's some of the bigger provinces that have been doing a lot of this work, or maybe it's just more visible because they have resources to bring to bear. So Ontario and BC, there's interesting things happening in Quebec here and there. There's also, but actually every province has some things going on. And some of it feels like, as you look at it, when it comes to access to care or legal supports, that sometimes it's 2 steps forward, 1 step back. Sometimes they've made available resources for healthcare, and then there's an election and the next group in says, no, that's not a priority, and they cut the budget. So there's always those kinds of issues. But I would say that over the last few years, definitely I'm seeing activities that are happening in a number of different provinces. I may be biased because I see more of what happens in BC than other places because that's where I live, but it feels like there's a lot of stuff happening in BC, in part because since 2015, we've actually had a dedicated portion of our provincial health services agency, TransCare BC, that's specifically mandated to focus on improving access to care and supporting healthcare providers in developing their competence to provide care and addressing the needs and supports across the entire province and not just leaving it to the Lower Mainland. Question asked about, are there resources for finding a trans competent primary care provider, and tried to access TransCare BC, but wasn't able to get specific names of doctors that are recommended. That's a tough one because I know that the Canadian Professional Association of Transgender Health a few years ago was looking at creating a provider directory across Canada that would offer that opportunity to sort of like help rate your primary doc thing for folks. And the challenge of actually having people willing to put their names out to say, yep, they provide this care, and then having other folks, provide accuracy about they're a really good care provider, it makes it tough. I would say that the opportunity to get some recommendations for who you can find who's trans competent either is through social networks, asking around among other trans and non-binary folks, or reaching out to like you might ask TransCare BC if they could recommend identifying who's taking patients. I do know that there are, depending on where you live in BC, there are providers and there are gender clinics, both for youth and for adults. So Three Bridges, for example, in Vancouver is a clinic that provides gender affirming primary care for folks. I think one of the challenges so far is that there's so much more need than there are clinicians available, that everyone who provides care, as soon as a clinic is known for providing that care, they get immediate swamped with folks wanting to access care. And so the waiting lists can rapidly become pretty quick. So the goal I know for TransCare BC is to provide education and training for all primary care providers, physicians, nurse practitioners, nurses, and in doing so, help increase that capacity across the entire province so that you aren't limited to specific places and long wait lists. Last question I see is were we able to understand at what age did young people discover their true gender identity, early childhood or in adolescence? And does this factor affect mental health? At this point, I'm trying to remember if we asked the specific question about how old people were when they, came out to people, which is different from how old they were when they identified as trans or non-binary. And I don't remember if we were able to ask that question. I do know that we haven't actually run those analyses yet, if we have asked the question. I think it's important to remember that gender identity is an important consideration that has a lot of different influences on it, including the safety of your environment. And so how people understand and think about their gender journey and their gender identity may actually unfold differently as they grow and develop and have better cognitive understanding of things, but also as the environment in which they live makes it safe for them to reveal or to think about even some of the questions they have about their gender. So I'm not sure that we would ever be able to get at that very easily. I do know that for a lot of young people, and there's research out of Seattle with Dr. Olson, who does a lot of work with young gender creative kids, that they are able to understand and identify their gender identity very early in life, across a variety of different genders, including cisgender youth. But that nuance of what that means, as well as how they might identify later on, is quite, as you grow and change, things become more salient for you. And if you don't have the words, and as young kids, a lot of times people don't have the words, then as they get older and they see examples and they find the words, they can be a little bit clearer about, yes, that's my gender identity, that's my sexual orientation, that's my political affiliation, those are my beliefs, those are my values, those are the things that are important to me. So I think that's an important consideration. Lorraine asked, are you seeing patterns about who is able to access care versus those experiencing barriers? We're still delving into that research. This was just the first quick pass, if you will, of research that was presented at the World Professional Association of Transgender Health, which is why we're able to offer this webinar again. But we are definitely continuing to explore the patterns around access, and we are definitely looking at things like ethnicity, race, and newcomer status and level of family support as they play out when it comes to thinking about access. Maja's asking, how can this research be used by advocates to improve access to trans healthcare for youth? Well, we are really happy for this research to be available so that advocates can take it up and use it, and that governments and others can use it to help inform their decision-making. We do have a general report. This is the opportunity to plug on our website. You can link to the Being Safe, Being Me 2019 report that actually provides some of the key findings, including the recommendations that young people suggested and that we as a research team would put forward in recommendations for improving health for trans and non-binary youth. These particular analyses are were done after that report was launched. And so these are much more in-depth than those particular findings. We have created some brief videos, and there are, remind me, Stephanie, do we have infographics with these results yet?
We don't. We okay. Have the videos, yeah. And there are sort of some infographics within the report. Right.
So we have we have some videos about these are brief animated videos about the research findings that are available for people to share. Sometimes that's easier for advocacy when people don't want all of the detailed statistics, but we are working to actually publish these results in both submitting it for peer-reviewed publication in professional journals, and we'll be looking at creating those one-page infographics that can pull out some of those key stats to help share that information so that people can use it to advocate for improved access to care. The other thing is if you don't see specific information, but it's possible we may actually have that information, you can always reach out and email us. And if we've already run those analyses, we can share that information. If we've already published it somewhere and you don't know about it, we can also share that. Well, we are coming up to the end of our time. Thank you all for participating and for attending this and for asking such great questions. We hope to be able to offer additional webinars in the future, so stay tuned.